Happy New Year for 2020. We would like to offer some suggestions for you and your staff to help you get a little bit more out of Open Dental software this year. We've got some very specific things we think you ought to look at that will hopefully allow you to provide better patient care, make everybody's jobs easier, and make the practice more profitable. This is a picture of some of the people that work at Open Dental. If you'll notice, we are not in this picture. We have no affiliations with Open Dental. If this sounds like an infomercial in this video, I apologize, but we really do believe in some of these features that Open Dental offers that nobody else has. To try and make some of these things a little bit more accessible, we've created a web page with a bunch of links on there. You can go to the web page at todaysdentalconsulting.com/resolutions, okay, with plural S, and then another /. We frequently get questions about what end of year, end of month, or end of day tasks you have to do with Open Dental. And the answer is you don't have to do anything. People are a little paranoid after using some other software, but with Open Dental, there's nothing that you need to do. Just for fun, I went in and created an annual report from 20 years ago. This is before we were even using Open Dental. This is something we could not get in our previous software, but Open Dental pulled all that information over for us. One thing we recommend is that you have monthly staff meetings. They should be about an hour. They should not be during lunch. They should probably be first thing in the morning. Everybody should participate. We should do some group think here, and they should be focused. Have an agenda that you present ahead of time so that people can think about it. These meetings are really beneficial and will give you some suggested topics that you might talk about. Every year the ADA comes out with new procedure codes. They delete other ones and they edit some of them. These become effective on January 1. So we want to make sure that we get those new procedure codes in there, and Open Dental makes this really easy. The first thing you want to do is upgrade to the current stable version right in the middle there. Then you want to use that little tool down in the lower left-hand corner to upgrade all your D codes. So that will suck in all the new codes, delete the ones that are no longer effective, and make any edits for you all automatically by Open Dental. These are not new procedure codes, but the reimbursement for these has changed a little bit with PPO plans. First of all, if you're using Fluoride Varnish, be sure you use the right code because it typically is reimbursed at a higher rate than fluoride in trays. The PPO plans, including Delta, have now started to pay for caries risk assessments in silver diamine fluoride. This improves your patient care and also increases the hygiene productivity. Look at your graphs every month and talk to the staff about them. These are free, these are created automatically, and they're user customizable so you can look at just what you want to see. You need to involve the staff in some disaster planning. What are they going to do when you have a fire in the office, or when your server goes down, or when you get hacked? There's been a lot of ransomware hacks of dental offices lately, and staff needs to know what to do. HIPAA requires that you do staff training and that you also have a written plan. A staff meeting qualifies as training. ADA's got a pretty good HIPAA manual there that you can get and customize, but involve the staff in helping you and help them understand what needs to be done. Open Dental has a brand new feature that they call supplemental backups. This is free, so why in the world wouldn't you use it? This does not replace your regular backup. This is a supplement to it, but it's a very valuable thing because people don't test their backups often enough. They also have endorsed a backup service, central data storage. I have not used them. I don't know anything about them, but if Open Dental endorses them, they're probably pretty good. People ask, what do we use? We use DMI networking down there on the bottom, and they'll do a free HIPAA consultation for you, which you may find alarming, but you probably should listen to what they have to say. You may need to update your office schedule. That's in Setup and Schedules. One new thing is that you block out your holidays ahead of time, and then when you cut and paste the schedule, it does not override those holidays. Correctly using the Make Recall button and the paperless routing slip, which Open Dental calls the dashboard, will really help your office, and we have videos on both these topics. It's time to start using paperless forms. There's lots of vendors that have these that integrate with Open Dental. Open Dental has their own, which is very good and has the advantage that it's free. Open Dental eServices is the only thing that Open Dental charges extra for in addition to your support. It's $135 a month, and in our opinion, it's a real bargain. Every office should be using the web schedule for recalls. Really powerful, does not require any changes on the part of the staff, works in the background. You want to reactivate patients, this is the way to do it, and it's included in eServices. This allows patients to schedule in the middle of the night when you're closed or when the staff can't get to the phone. This gives you a big competitive advantage. Your scheduling is now open 24/7. The Text ASAP feature takes a little setup and a little training on the part of the staff, but it changes the best way to keep your appointment book full and productive. We have a video on this with a link on the website. Last but not least, you want to reevaluate your fees at least once a year, and Open Dental has a really good tool for increasing your fees. Don't get carried away, but keep in mind that every dollar of increased fees goes directly to your bottom line. That's clear net to you. You've already paid the overhead on that. A useful tool for seeing how your fees stack up to other practices in your zip code is this ndas survey. And there's a link to this on your website. It's not very cheap. It's about $170. But it gives you the different percentiles by particular procedure. And so you can say, yeah, we're right about the 70th percentile. Very useful thing to do at least every couple years. A final reminder to go to our website, todaysdentalconsulting.com/resolutions/ for links to this stuff, just to make it a little bit easier for you to find more information on these topics. Hopefully this little video has given you some ideas and also some topics for staff meetings for 2020. Again, the goal is to use Open Dental to improve your patient care, to make everybody's jobs easier, and to make the practice more profitable. If we can help you with any of these things, we're here. Be sure and give us a call. Best wishes for a productive and profitable and very happy new year.